For many couples having sex for the first time, the experience is dominated by sudden panic, deep confusion, and a bizarre sense that their bodies have completely forgotten how to function. We rarely talk about this out loud. Movies and cultural narratives sell a specific image of effortless, flawless synchronization from the very first second. Because of that silence, when a new couple hits a wall of physical discomfort or awkwardness, they immediately assume something is broken in their relationship, or worse, in themselves. But hitting that wall is actually a mandatory physiological process. Experiencing extreme difficulty early on is a standard biological baseline, while your nervous system adapts to a new environment. As we can see in this framework, building true intimacy requires actively navigating three distinct biological and temporal phases: the mind, the body, and time. Most people arrive at their first partnered experience with some baseline of body awareness, often developed through solitary self-pleasure. But bringing a second person into the equation introduces entirely unpredictable sensory inputs. You suddenly lose total control over the pressure, the angle, and the rhythm. The brain responds to this chaotic new data with immediate performance anxiety. An internal monologue starts racing, constantly questioning every single movement as right or wrong. This creates massive cognitive friction. You are so busy analyzing the situation that it becomes temporarily impossible to accurately process or enjoy any physical sensation. If you feel mentally paralyzed in bed, it does not mean you lack attraction to your partner. It is simply your brain deploying a psychological defense mechanism against cognitive overload from novel stimuli. Understanding the psychological overload reveals its immediate physical barrier. This diagram highlights the exact friction point where mind impacts body: pain. For virgin couples, this tracks along two simultaneous lines: an erratic spike of psychological anticipation overlapping the rigid reality of physical friction. This dual-layered pain acts as the primary roadblock for new couples. The acute discomfort often causes the physical act to halt entirely. The immediate solution is entirely mechanical. External tools, like artificial lubricants, are a biological necessity to artificially reduce that friction while your bodily tissues adapt. When you treat this physical barrier as a simple mechanical issue requiring tools, rather than a romantic failure, you remove the shame. That mental relief is what actually allows the physical body to relax. Even after you calm the mental panic and soothe the physical pain, your body still has to figure out how to physically move in tandem with someone else. Adjusting your positioning, opening your body to new angles, and synchronizing your movements, these are entirely novel biomechanical skills. The idea of spontaneous physical compatibility is a myth. Discovering the right sexual positions requires explicit education, active research, and heavy trial and error. Couples have to communicate out loud. You must awkwardly test different mechanics to discover exactly what suits your specific anatomies. Physical compatibility is never an innate gift. It is a highly specific skill acquired through conscious practice and mutual instruction. This chart shows the adaptation timeline for new couples. Notice the sharp initial spike in difficulty, smoothing into a rising line of comfort. Look at the plateau markers at month 6 and 8. That extended window is the mandatory period for bodies to adapt. If you are struggling, stopping, or feeling like you are failing in those first few months, you are exactly where you are supposed to be. The next steps are highly practical. Grant yourselves some grace. Read clinical articles, use lubricants, and consult a sexologist to bypass unnecessary hurdles. A fulfilling sexual relationship is never found in a flawless first attempt. It is a resilient structure carefully built over months through patience, education, and time.